Welcome. Have you ever heard of pilonidal disease? It's a condition that affects many people, often young adults, and can cause significant discomfort. In this video, we'll explore everything you need to know about pilonidal disease, from its causes and symptoms to diagnosis and treatment. Join us as we delve into this common yet often misunderstood condition. The exact cause of pilonidal disease isn't completely understood, but it's believed to be related to ingrown hairs. Friction and pressure, such as from prolonged sitting tight clothing or obesity, can force hairs into the skin. These hairs then become embedded, irritating the area and leading to the formation of a cyst or sinus. Genetics may also play a role, making some individuals more susceptible. When a hair penetrates the skin, the body recognizes it as a foreign object. This triggers an inflammatory response, leading to the formation of a cyst around the hair. This cyst can become infected, forming an abscess filled with pus. The infection can then spread, creating sinus tracts, which are channels that connect the abscess to the skin surface. These sinus tracts can drain pus and debris, leading to chronic inflammation and discomfort. Pilonidal disease is most common in young adults, typically between the ages of 15 and 40. It's also more prevalent in men than women. People with sedentary lifestyles, excessive body hair, obesity, or a family history of the condition are at increased risk. Certain occupations that involve prolonged sitting, such as truck driving, can also contribute to the development of pilonidal disease. The symptoms of pilonidal disease can vary depending on the severity of the condition. Initially, you might notice a small, painless pit or dimple in the skin near the tailbone. As the condition progresses, you may experience pain, swelling, redness, and drainage of pus or blood. In some cases, a fever may develop if the infection is severe. The pain can worsen with sitting, bending, or other activities that put pressure on the affected area. Diagnosis of pilonidal disease is typically based on a physical examination. Your doctor will examine the area around your tailbone for signs of cysts, sinus tracts, and inflammation. They may also ask about your symptoms and medical history. In some cases, imaging tests, such as an MRI or ultrasound, may be used to rule out other conditions or to assess the extent of the disease. While there aren't distinct types of pilonidal disease in the same way as some other conditions, it's often classified by its severity and chronicity. It can range from asymptomatic or mild cases with just a small pit, to acute abscesses requiring immediate drainage, to chronic, recurring pilonidal disease with multiple sinus tracts and persistent symptoms. Treatment for pilonidal disease depends on the severity of the condition. For mild cases, conservative measures such as good hygiene, warm compresses, and avoiding prolonged sitting may be sufficient. If an abscess develops, it needs to be drained by a doctor. For more severe or recurrent cases, surgical options may be necessary. These options include excision of the cyst and sinus tracts, either through open wound healing, primary closure, or flap reconstruction. Minimally invasive techniques, such as pit picking or endoscopic sinus excision, are also becoming increasingly popular. Preventing pilonidal disease involves maintaining good hygiene, especially in the affected area. This includes washing the area regularly with soap and water and drying it thoroughly. Avoid prolonged sitting, and if you must sit for extended periods, use a cushion to reduce pressure on your tailbone. Weight management is also important, as obesity increases the risk of developing the condition. Hair removal, such as shaving, waxing, or laser hair removal, can also help prevent ingrown hairs. The prognosis for pilonidal disease is generally good with appropriate treatment. However, recurrence is common, especially after simple drainage procedures. Surgical excision offers a higher chance of long-term resolution. Recent research is focused on developing less invasive surgical techniques and identifying genetic factors that may contribute to the disease. Studies are also exploring the use of sealants or fillers to close sinus tracts and prevent recurrence. Staying informed about the latest advancements can help you make informed decisions about your treatment options and improve your overall outcome.